Good day, everyone. For today, we will be discussing management of a specific poison, and we will be focusing on metallic poison. Metal poisoning, also known as heavy metal toxicity, occurs when high levels of certain metals accumulate in the body. These metals, such as lead, mercury, arsenic, cadmium, and others, can enter the body through various means, including ingestion, inhalation, or skin contact. And once na nasa loob na ng ating katawan, dinidisrupt nila yung normal biological processes. At nagkukos sila ng damage sa ating organs and tissues. For the symptoms, nakadepende sa type at amount ng metal, but it may include nausea, vomiting, abdominal pain, neurological symptoms, and organ damage. And for the treatment, it often involves removing the source of exposure and may include chelation therapy. Sa ating chelation therapy, gumagamit ng mga certain drugs, medicines, para matanggal yung metals sa ating katawan. And ang example po dito ay yung ating ethylene diamine tetraacetic acid, which is given through IV. For our first heavy metal, we have the arsenic. Arsenic, also known as salvarsan or asphenamine source. Tinawag po siyang salvarsan or asphenamine source because it is the key component of salvarsan. And arsenic compounds could effectively combat syphilis. Kasi alam po natin na ang salvarsan is one of the earliest synthetic drugs used to treat syphilis. Our arsenic is an inorganic metal irritant, 12th most abundant element on the earth, and it is neither a metal or non-metal. It is extremely poisonous to humans kasi wala po siyang lasa or amoy, kaya pwede po tayong ma-expose without knowing it. Natural sources are soil, water, and some fishes, and our tobacco smoke also contain arsenic. Organic arsenic is ubiquitous in the environment. Kapag sinabi po nating ubiquitous, present or nahanap po siya kahit saan. And for inorganic arsenic, we have insecticide, fungicide, rodenticide, and compounds used in glass manufacturing. And arsen gas is produced in melting of metals and making of silicon microchips and lead plating. For toxicokinetics, it interferes with oxidative phosphorylation, which is the crucial metabolic process that generates adenosine triphosphate, which is the primary currency of cells. Ang arsenic po natin ay dinidisrupt niya yung function ng enzyme sa ating oxidative phosphorylation, such as those in the electron transport chain, located sa ating mitochondria. And this disruption leads to decrease of ATP production and cellular dysfunction. For clinical presentation, we have acute poisoning, which is the sweet garlic odor or yung tinatawag po nating garlic breath. Nangangamoy pong bawang yung ating hininga. And for our chronic poisoning, we have the polyneuritis. Ito po ay nakukuha sa contaminated water. It is the inflammation of multiple peripheral nerves. Next is we have the skin changes. We have erythroderma, which is the widespread of redness and scaling of the skin. And we have hyperkeratosis. Ito po yung pagkapal ng ating outer layer skin. For our Aldrich-Miss lines, these are lines of discoloration across the nails of the fingers and toes na makikita po natin sa picture.
So, the next heavy metal is beryllium. Beryllium, it is discovered by French chemist Louis-Nicolas Vauquelin in year 1798. Vauquelin suggested the name glucinum meaning sweet tasting for the element because the element and some of its compound have a sweet taste. That's why beryllium it is also known as glucinum or sweet taste. Beryllium it is the most toxic metal. So here are some signs and symptoms when you inhale beryllium. We have skin irritation, berylliosis, or chronic lung granuloma. So what is berylliosis? It is a rare disease caused by prolonged exposure to the chemical element beryllium. It is a chronic inflammation in your lungs due to inhaling fumes or dust containing beryllium. Most studies shows that between 2 to 5% of workers who are susceptible to beryllium sensitization will develop the disease after exposure to beryllium. Many people work regularly with beryllium and do not develop beryllium sensitization or CBD. So we have here the symptoms of berylliosis, but first there are two types of berylliosis. We have the chronic berylliosis and then the acute berylliosis. First, we have the chronic berylliosis. It is a lung disease that develops in people who have become sensitized to beryllium. It's an autoimmune condition and can be mistaken for disease like sarcoidosis. Chronic beryllium disease can develop at any time after someone becomes sensitized to beryllium, even if they have no more exposure to beryllium-containing products. While acute berylliosis, it is very rare today. Current workplace safety regulation prevent the quantities of beryllium that can cause acute beryllium disease from being released into the air. Acute beryllium disease has a rapid onset and progress quickly. It's also caused by breathing in beryllium. So the symptoms for chronic berylliosis is coughing, fever, fatigue, weight loss, chest pain, and shortness of breath. While acute berylliosis, we have pneumonitis, skin rash, and eye irritation. So here are some diagnoses for berylliosis. We have physical exam, occupational history, bronchoalveolar lavage, beryllium lymphocyte, proliferation test, and imaging studies.
For the next topic, the cadmium. It is a toxic heavy metals which is commonly used in industrial activities such as manufacturing of batteries, metal coating, and plastic. In terms naman sa exposure of cadmium, this is the common sources and route of exposure. The inhalation of tobacco smoke, the ingestion of water and food contamination, and the dermal contact. So sa mechanism of toxicity naman, when cadmium enters the body through the various routes na na-mention kanina, maa-absorb siya in the bloodstream. Since yung kidney is responsible for filtration process, within this kidney, may mag-filter ng blood, removing the waste products or toxins, specifically the cadmium. When this cadmium remain on the kidney, and kapag continuously na na-expose into cadmium, mag-accumulate siya that cause renal toxicity or the nephrotoxicity. Fanconi-like syndrome is a symptoms of cadmium exposure. It is a defect in reabsorption of substance. This includes osteomalacia or the soft bone disease and the renal tubular dysfunction. Since yung renal tubule natin is responsible in the reabsorption of essential substances, magkakaroon siya ng issue or dysfunction regarding dito. Instead na magre-reabsorb siya, mas madami yung ma-excrete na essential substances. For example, the glucosuria. It is the excessive excretion of glucose in urine. Aminoaciduria, increased excretion of amino acid in the urine. Phosphaturia, excessive excretion of phosphate in the urine and including the electrolyte imbalance. The another mechanism of toxicity is on the bone toxicity, where cadmium causes itay-itay disease or it hurts disease in English. This is a severe exposure of cadmium through a contaminated water and foods. Dito naman, yung presence ng calcium na-attract yung cadmium. And this cadmium replaces the calcium in the bone tissues, disrupting the bone metabolism, leading to a weakened bones, includes osteoporosis, bone deformation, and bone pain. Yung calcium kasi dito is nagbibigay ng strength sa mga bone tissues. Since same sila ng size and charge ni cadmium, nare-replace niya ito pero di nagbibigay ng structural support. Instead, mas lalong humihina yung mga bones.
The next heavy metal is copper. Copper causes Wilson's disease. Wilson's disease is a rare autosomal recessive disorder caused by abnormal copper accumulation in the body, particularly in the brain, liver, and cornea. The signs and symptoms are nausea and vomiting. Blue-green vomitus means copper poisoning. Green discoloration of hair. Liver, we have abdominal pain, dark urine or a light stool color. Jaundice means yellowish of the skin and the whites of the eye. In brain, we have mood change, anxiety and depression, disruptive thoughts and feelings. In nervous system, we have tremors, stiff muscles, and problems with coordination. And we have Kayser-Fleischer ring, accumulation of copper in the corneal limbus. So yung nakikita nyo dyan sa may picture na brown or grayish-green na nag-a-appear to encircle yung peripheral cornea natin, then nakapatong siya dun sa may iris. Yun yung tinatawag na Kayser-Fleischer ring. And the treatment for this disease is penicillamine.
So next heavy metal is iron. Iron resembles sweetness, and for its sign and symptoms for iron poisoning is black stool for the upper GI tract and bloody stool naman sa lower. And for its treatment is deferoxamine. So yung use ng iron is used as a pediatric or prenatal vitamin supplement and for treatment of anemia. So kailangan talaga sa nagbubuntis kasi para ma-prevent niya yung iron deficiency, anemia during pregnancy. And then mechanism of toxicity naman sa local is may malalang pinsala sa GI tract, GI mucosa, corrosive damages to gastrointestinal mucosa, and then acute gastroenteritis may contribute to early cardiovascular toxicity through fluid and blood loss. So, yung acute gastroenteritis is yung matubig na pagtatae or yung diarrhea, and it may cause early cardiovascular toxicity or pinsala sa puso through the pagkawalan ng fluid and blood. And then systemic sa cardiovascular system is iron causes massive post-arteriolar dilation. Yung massive post-arteriolar dilation naman is which yung blood vessels ay lumalawak at inaalaw nito na mas maraming dugo ang mag-flow at nagpapababa ng blood pressure. And then leading to venous pooling. Kaya nga pooling because yung venous pooling is hindi dumadaloy pabalik ng maayos sa heart yung blood, at ito ang nagiging cause ng pag-ipon ng blood sa mga veins ng legs. Kaya nga pooling. So it means may naiipon na blood, and this followed by increased capillary permeability leading to hypotension and shock. And then iron din has direct myocardial depressant effects. And then sa liver naman is yung mechanism of toxicity niya is free iron accumulates in Kupffer cells. Kupffer cells are phagocytic cell na nagpo-form sa lining ng sinusoid ng liver. Then hepatocytes, which means hepatocytes is yung major parenchymal cells sa liver na humahantong to periportal necrosis. And then symptoms of iron poisoning sa acute gastrointestinal symptoms like hematemesis or abdominal pain. Hematemesis is yung pag-bleed internally, and then hypovolemic shock. Sa subacute naman is hepatic dysfunction, hepatic necrosis or yung pagkasira ng liver, renal failure, pagkasira ng kidney. And chronic naman is pyloric stenosis or proximal bowel scarring, which means yung pyloric stenosis is yung pag-narrow ng pylorus, and then yung pylorus na yun ay yung opening na mula sa tiyan patungo sa mga small intestines, severe abdominal pain and malaise. For other treatment naman is supportive care, fluid and electrolyte repletion, which kailangan talaga na once na may iron poisoning, dapat ma-rehydrate yung patient. And then whole bowel irrigation, chelation therapy, which means ito yung mga deferoxamine, kagaya ng nabanggit kanina, deferoxyrox, and then defereprone. So, mapapansin nyo na may fe yung mga drugs. So, it means tinuturo nito yung Fe, which means the symbol of iron. And then, iron does not absorb to activated charcoal. So, alam natin na yung activated charcoal is yung mga first-line treatment for poisonings. Pero si iron, hindi niya ina-absorb yung activated charcoal.
So next we have the heavy metals, which is lead. Lead poisoning can cause by exposure to high levels of lead. Lead is most commonly found in houses built before 1978. So symptoms of lead may include black gum lines, wrist drop and foot, and also headaches, cramps, and hyperactivity. Lead poisoning can be diagnosed through a blood lead test. So, lead is especially dangerous to babies. It can harm them even before they born. So, lead, ayan, nakikita siya sa mga houses. For example, we have the lead paint. Children who live in older houses with peeling lead paint or lead pipes are often affected, kaya dangerous siya sa mga bata. So, lead can also contaminate sa mga herbal medicines or medicines natin. Toys and candies from foreign countries, stained glass, leaded crystal glasswares, glazed ceramic ware, including yung ating mga plate, pitchers, and cups. So, meron naman po siyang treatment, which is the edetate calcium disodium, is a chelator that is primarily used for the management of patients with severe lead poisoning. Kaya ang mga treatment sa mga na poison po ng lead is yung ating chelation therapy. Next heavy metals we have is the mercury. Mercury, aka quicksilver, meron po siyang mga sources, which is the elemental, inorganic, and also organic. So, elemental mercury, makikita po natin siya sa mga amalgams, thermometers, electrical switches, fluorescent light bulbs, and also sa mga dental fillings na ginagamit ng mga dentists. Next, we have the inorganic mercury. You'll find inorganic mercury in batteries, certain types of disinfectants and in chemistry labs. So, meron din tayong yung mga mercurous chloride natin, which is calomel, mercury chloride na corrosive sublimate. Next, we have the organic mercury. So, makikita po natin siya sa mga coal fumes, fish that ate methyl mercury, which is a form of organic mercury, and older antiseptics, which nakaka-kill ng mga germs like red mercurochrome. And then, this mercury causes Minamata disease. Ayan po yung example. And symptoms may include photophobia, irritability, pink disease, or acrodynia, which is nagpipink yung mga palms natin and yung ating mga soles. So, meron naman siyang treatment, and yung treatment po niya is dimercaprol. Pag high exposure, penicillamine. Pag low exposure, and yung most effective po sa kanila,
which is yung ating sodium formaldehyde sulfoxylate.
For our last heavy metal, we have the thallium. Thallium, also known as poisoner's poison or inheritance powder. It is a deadly poison because of its ability to cause severe illness or death even in small doses. For its symptoms or side effects, we have hair loss or yung tinatawag po nating alopecia. Kasi po yung thallium natin ay dinidisrupt niya yung normal growth cycle ng ating hair follicles kaya po tayo nagkakaroon ng hair loss. For nail dystrophy, ito po yung abnormalities in the growth structure or appearance ng ating mga kuko. And it is same with hair loss. For peripheral nerve damage or yung tinatawag po nating peripheral neuropathy, ito po yung damage sa ating peripheral nerves at yun po yung mga nerves outside sa ating brain and spinal cord. For the treatment, we have the Prussian blue, which will be binding to thallium in the GI tract and preventing its absorption in the bloodstream, thereby reducing the amount of thallium available for the distribution to tissues and organs. And that's the end of our discussion. Thank you for listening.